When I was diagnosed with prostate cancer, I really wasn't aware of what was going to happen afterwards. You're diagnosed, you go in, and they decide what type of treatment they're going to do, if they're going to remove the prostate or they're going to treat it, or this type of thing, which I chose removal. Then you start living with the bladder leakage, and you kind of get used to it, and you think, well, this is what I'm going to have to live with. It's always there. You know it's there. You're wearing pads. You're always constantly making sure you have more pads. You fill all your pockets up with pads if you're going somewhere. And you're constantly looking down to see if the pad has moved and the front of your pants might be wet. The bladder leakage didn't occur like at night. It was only during the day. So at night, you had no bladder leakage, only when you were active. I used to walk like 3.5 miles a day, and I had to quit walking because I could drain my bladder before I walked, and before I got back, my pants would be wet. My sweatsuit would be wet. I had an excellent surgeon, and he would say, it'll get better. It might be a year. It'll get better. And I just kept hoping that it would get better, not complaining, because my leakage really wasn't that much, maybe 2 pads a day, but any amount of urine is too much. And when I would talk to him, he'd say, well, it'll get better, give it a little bit longer, a little more time. Well, when it went on for 2.5 years, that's a long time.